know,
or maybe that's me. This real quick.
That should work.
Okay. Okay, so welcome to our first annual Lunch and Learn. I have created these I'm creating these to go over things that we have, that we do, and in the clinic specifically, and try to get, a more systematic and better way, so we do the same across all clinics. So this first lecture, we're going to talk about common errors in drug screens. So this is really for anyone who participates in drug screen and drug screen collections. For future Lunch and Learns, if anybody has ideas that they want to present or they want to talk about, I know we can add, whatever issues may come up. I know there's been talk of doing phlebotomy or working up a trauma patient. So in the future, if you have ideas, please let me know. So DOTs, exactly. So let's go ahead and get started. So the objectives today, we're going to identify some common urine drug screen collection errors. We're going to talk about the different reasons for DOT testing. I'm going to just give some reminders related to documentation that I'm sure everybody knows, but we're going to just talk about them again. I'm going to discuss the fatal flaws that can really be problematic in drug screen collection. And then we're going to talk briefly about when observed collections are required. If you guys get any questions, just or if we have questions, you can also put them in the chat if you can't unmute yourself. We'll check that at the end. Okay, so why do we care so much about drug screens? Well, they are, for us, very high stakes. So there's quite a bit of legal consequences that can come if they're done improperly. Tests can be canceled or rejected by the lab. This causes employers to not be able to act, so they cannot, instigate taking people out of safety sensitive work. And because of that, they can become uncompliant with DOT. So we really want to make sure that we're doing it correctly. The worst thing that could probably happen is someone being fired for something that we did or something that we could have prevented. Exactly. So that, as well as lawsuits, are big problems. When people have to repeat testing, also, which sometimes they do, this causes delays, and this costs the company and us money. So these are all the reasons why we have to be vigilant. Okay, so first we're going to talk about the reasons for testing. And this is just a screenshot from FormFox. You can see the reasons for testing: pre-employment, random, post-accident, reasonable suspicion or reasonable cause, follow-up, and return to duty. So we're going to go through all of those now. So for pre-employment testing is to screen applicants before they're hired, as it says, pre-employment. This test must be negative for someone to start a safety-sensitive job. So all DOTs cannot start their job until they have a negative pre-employment test. This test can be done anytime prior to starting work. So it always amazes me how people come in and they want to, try to manipulate, bring in fake urine or whatever, when you can schedule this test. So I've never understood why this is. I mean, I guess if your company gives you 2 weeks or something to get it done, and that might not be enough for people to to have metabolized everything out of their bodies, but we still get a lot of issues with these. Again, it's supposed to be done to prevent high-risk hires, and there's some evidence that it works, but like all testing, people can get around it. The next is randoms. Randoms are for people who are already employed. The goal of randoms are to deter people from using and obviously to detect use. The rules related to randoms is that it must be a truly random selection. So whenever someone's name gets pulled out of the pool, it has to go back into the pool in order to be, have the same chance of being selected again. So you can be never selected, and some people can be selected multiple times a year. That always is weird because some people are like, well, they're picking on me because I have to do all these randoms. No, it's just how the pool works. It's just how the random selection works. These are usually unannounced, and they're spread throughout the year. There are numbers that the DOT companies have to do. They have to do a certain number of random tests per quarter or per year in order to be compliant with DOT. These, when someone gets selected, these are the ones that they have a certain number of time, like hours, in order to get the test done. So the person must proceed to testing immediately. The next category is reasonable suspicion or for cause testing. This one is always interesting because this one, the trigger for a reasonable suspicion is the employer or an employee who usually tells a supervisor, they observe behavior that suggests that the person is either impaired or has a drug and alcohol use disorder, or they're misusing some sort of substance. So the person can be seen doing something at work that is worrisome. So reasonable suspicions, usually the person comes in. These, if they're actively drunk or actively high, they're going to appear lethargic many times, confused, not able to answer questions. The employer needs to describe what they're seeing so that we can put this as check this off as the reason for testing. So they're going to need to explain to us their appearance, their behavior, how they're talking, and then of course also if people smell of alcohol, that's part of reasonable suspicion. However, it can't be done by just rumor or history alone. So somebody says, oh, so-and-so drinks a lot on Facebook, and then the company selects that person and says, oh, we reasonably suspect this person is drinking. No, absolutely not. They cannot do it just by what someone says. They have to do it based on what the employer, see, usually at the workplace. So they see the person look impaired or intoxicated, they send them in for testing. Next is post-accident. Again, performed after an accident. There are specific criteria in DOT related to if the accident causes an injury, if the accident results in a citation, or the accident results in a fatality. Post-accident testing is required by DOT. So some companies will say, well, we had an accident, just do the test. And that's true, they can do that. But just remember that DOT has some post-accident that is actually required of them. It's not just if the company wants to do it or not. So now we're going to talk about return to duties and follow-up tests. And these are probably the most confusing because we use return to duty often, follow-up test often with other things we do in occupational medicine. So return to duty testing is done when someone has already had a positive test or a refusal, and they are currently in a program or being evaluated by a substance abuse professional. So this return to duty test is directed by the employer because of what the substance abuse professional says. All return to duty tests are done under direct observation. So sometimes people will come in, they're returned to work and they need a drug screen, and you would say, oh, this is a return to duty drug screen. No, because all return to duty drug screens must be directly observed, and they have to be directed by the substance abuse professional. So this will come from the company. You will know that the person needs a return to duty directly observed test. The other test that's often confused is follow-up testing. Follow-up testing are also done under direct observation, and they are to monitor people who are in a substance abuse professional program, not just the first test, but they have to do several tests. So these are kind of like randoms, but for the SAP program. So they're unannounced and they're separate from a true random pool. These are, again, directed by the substance abuse professional. They'll say, oh, you have to do 12 a year, or you have to do 14 a year. This is all directed by them, again, directly observed. Before we move on to DOT versus non-DOT, I'm just going to stop. Does anybody have any questions? You can unmute yourself or.
Excellent.
Oh, yeah, thanks. Let's see here. I'm just going to check the chat real quick. No questions from Janelle. Okay, we'll just keep going then. Okay, so DOT versus non-DOT. The DOT regulated federal agencies are one of these 6 agencies on the screen here. So FMCSA are commercial drivers, FAA is aviation, FRA is the railroad, FTA is people who work in transit other than like commercial driving, who have safety sensitive jobs. The PHMSA, I think, is pipe fitters. And then the USCG is the Coast Guard. So all of these entities must do some form of DOT testing. The other companies who do not fall under this can choose either DOT or non-DOT. Many times they choose non-DOT because they have more options. You can, do saliva, rapid, stuff like that. Sometimes though, companies will say, I just want to do DOT. So if they choose that, they are doing essentially the same as all of the federal agencies on this screen. So I think the selection of DOT versus non-DOT is one of the most common errors on a drug screen collection. You got to make sure, just double, triple check that the entity wants a DOT test or does not want a DOT test. And even some companies might say, oh, I don't want a DOT test, and they, historically have done all DOT tests. You just want to, again, double check with that company. Are you sure you don't want a DOT test? Because, a non-DOT test won't count in your DOT program. Okay. Now we're going to just talk about some documentation reminders and FormFox. These most people know, but we're just going to review them again. So here's step 2 of the CCF, electronic CCF and FormFox. The temperature. We know we have to get the temperature within 4 minutes of the person leaving the bathroom, usually right away, right? Usually you're going to look, double check, and look at the temperature strip, see it, and move forward. But not only do you have to look at it and confirm it, you must check it on the CCF. So we have had instances where it has not been checked. That big red arrow is just to remind you. Also, we do quite a bit of observed here. So if the person has observed paperwork and we do all the observed stuff, it also needs to be checked on the CCF. So those are just 2 reminders that we often see as errors. Any questions or follow up on it, guys? No. This also is a screenshot from FormFox. This is the collector signature. And so this is really just a reminder that the collector must sign the CCF and the collector's name needs to be on the CCF. And if it is not, that is one of those fatal flaws that can reject the test and cause a bunch of problems. So this is a reminder to always make sure your name's on it, it's the correct name, and that you sign it. And just for completeness sake, I'd want to go through all the fatal flaws. These are the things that if you do them, this will reject the test, cancel the test, and again, have more problems. So the first one is no specimen ID on the bottle or on the CCF. Or if the specimen ID, oh, Regina, go ahead.
I have a question. Well, not a question, but a statement.
Sure.
When you were doing the collections, and at the beginning of the collection, it asks, is this a DOT or non-DOT? Please verify that it is a true DOT, because it's an electronic CCF. If it's not, if you choose non-DOT, we cannot change it to a DOT if it's supposed to be a DOT. So you need to verify that that is a true DOT.
Right. There's no going back. Once you do it,
we cannot change it. Once you hit that yes or no button, we cannot upgrade it. So you need to verify that it is a true non-DOT or a true DOT. We cannot change it. Now, if it's a paper CCF, we can change it, but electronic CCF, we can't.
Gotcha. Any other comments or thoughts? Questions? Okay. So back to the fatal flaws. If, again, we'll start the no specimen ID on the bottle or the CCF, or the specimen ID doesn't match between the bottle and the CCF, fatal flaw. No collector signature or no name on the CCF of the collector is a fatal flaw. Of the donor, it's a fatal flaw. If the specimen label bottle seal is missing or broken, that can be a fatal flaw, or is a fatal flaw. Insufficient volume in bottle A of the primary specimen, or if the specimen does not have a CCF with it. So these are all things that, again, these similar to with the DOT, non-DOT, that we can't go back. There's no changing it. Once you make this mistake, we have to redo the testing. Another reminder here, we get this a lot, is that because we use electronic CCFs, we need to have the electronic signature, but we also must have the wet signature. So, and that's of the donor and the collector. So this is just a reminder that you got to have both when you're doing an electronic CCF. Okay, observe collections. This is everyone's least favorite topic and drug screen. So these, again, they're required for return to duties, follow-up tests. They're also required if the temperature is out of range, or we suspect tampering. So if they come out with blue urine, they have to have an observed collection. We have a pretty good kind of chart that we do before we do all observed collections that all patients can see. I'm still amazed that when we do them, people go in the bathroom and they're like, I have no idea what to do. So it's good to actually have them look at it before and say, you're going to have to raise your shirt above your navel. You're going to have to pull your pants and your underpants to your mid-thigh, and you're going to have to spin around. And the person who's observing you has to watch the urine leave your body. Because if you don't spell it out for people in that explicit detail, they're going to walk in the exam room and be like, what do I do? Or went to the bathroom and be like, what do I do? And we don't want to have a conflict with someone while they're in the bathroom. This person must be the same gender or the same gender identity of the donor. So if there's any question, which we have had, any question of somebody who discloses that they're transgender and they do not want the other person, because that person is of a different gender identity with them, we don't move forward with that. The only way we do it is if that person agrees that the person's gender identity that is observing them is the same of theirs. So gender is usually pretty easy. This is usually pretty easy, but we have had issues related to gender identity. So just actually, usually it's not a big deal. The person is female, identifies as male, is fine if a male observes. Okay, done. But again, we got to be sure that everybody is comfortable, and that includes the collector. If we have a collector and they are not comfortable observing someone, they should not be doing it, because that is just going to be more issues, fodder for the test to be rejected. We got to have everybody be on the same page when they go into the exam room or into the bathroom, what's going to happen. Another thing just to remember, we've already talked about it before, is you got to document that it was observed on the CCF. You can't just, have our paperwork and it's assumed that it is observed. It has to be documented on the CCF. And this is a reminder, this is my final slide. This is a reminder from Katrina that once we start a collection, so a cup is opened, an oral test, we break open the packet. Many times people walk out because, they don't like what we're going to do. They know they're going to be positive. They are just being silly. And if that is all the case, if that happens, these are still billable interactions. So the company still has to pay for the cup. They still have to pay for the oral test. And this also goes for if someone is on shy bladder or there is an incomplete collection. Please put that all in the computer, because we still need to bill for that. Because it's our time. It's, these people can be, again, really silly, and we shouldn't just be saying, okay, we're done, throw it all away and move on. Be sure to bill. And that is actually all I have. We have 7 minutes. These are going to always be pretty quick. So I'm going to leave plenty of time for questions. And if nobody has any questions, we can go ahead and adjourn. Regina, did you have any follow-up?
No.
No.
Mm-hmm.
Guys, any questions? Okay, so I will go ahead and end this. If anybody has any thoughts or subjects that they want me or another leader to go through, this is the forum. Please send me anything you'd like to do, and I'll try to make it happen. So with that, everybody have a good rest of your day and have a good lunch. Bye-bye.
Yeah.
Yeah.